everyone. My name is Elektra Diakolambrianou. I'm a psychologist and psychotherapist from Greece and also a LARP designer at the non-profit LARP company LARPifiers. Today I will be making a short introduction to psychotherapeutic applications of role-playing for the Transformative Play initiative at Uppsala University in Sweden. So during this video, we will first get acquainted with some definitions. Then we will look at role-playing as a technique used in talk psychotherapies, drama-based approaches, play-based approaches, and game-based approaches of therapy. And then we will look at a bit more details in geek therapy, superhero therapy, therapy board games, video games that can be used in therapy, tabletop role-playing, and live-action role-playing. So, first of all, let's see at the definition of role-playing. Wikipedia says that role-playing is the changing of one's behavior to assume a role, either unconsciously to fill in a social role or consciously to act out an adopted role. Merriam-Webster puts it, more laconically, that role-playing means to represent inaction. Then if we look at Raymond Corsini and his book Role-Playing in Psychotherapy, he tells us that role-playing is the most naturalistic form of psychotherapy, in the safety of which one can be guided into more competent ways of living. And this is what we will essentially be talking about today. Now, what does psychotherapeutic mean? Psychotherapeutic, according to Oxford Languages, is relating to or denoting the treatment of mental disorders by psychological rather than medical means. Generally, throughout this presentation, we will be using the definition of psychotherapy as a process whereby psychological problems are treated through communication and relationship factors between an individual and a trained medical health professional, mental health professional. This is very important so that we can distinguish psychotherapeutic from therapeutic. Therapeutic means having a beneficial effect on the body or mind, producing a useful or favorable result or effect, or having a healing effect, tending to make a person healthier. Also, it should be distinguished from transformative, which means causing or able to cause and lasting change in someone or something, or causing a major change to something or someone, especially in a way that makes it or them better. In other words, those concepts are very closely related, and something that is psychotherapeutic is probably also therapeutic and transformative, but not the other way around. Now, let's take a look at role-playing as a technique in talk psychotherapies. We can find role-playing techniques in humanistic and experiential psychotherapies. This is a framework that allows clients to use expressive tools and activities to reenact or recreate situation, past and present, and this can be achieved through the use of role-playing. In Gestalt psychotherapy, which emphasizes personal responsibility and focuses on the present moment and experimental freedom, role-playing is used in a variety of techniques. One of the most well-known ones is the empty chair technique, in which the client is encouraged to have an empty chair across from him or her and imagine a person of great importance sitting there and enact a role play in which they can tell this person things that they haven't been to say in real life. Now, in narrative psychotherapy, role-playing has been used as a technique to identify and reinterpret the stories that we develop and live out, so our personal narratives, as well as the meaning that they carry for us. Systemic therapy generally seeks to address people not only as individuals, but also as belonging to relationships and focusing on interactional patterns and dynamics within this relationship. And role-playing here can be used as a technique to identify and reinterpret these patterns. Similarly, family systems therapy is an approach that puts a special focus on resolving problems in the context of family units, and role-playing can be a very strong technique to use there. Now, we also have fixed role therapy and role-play therapy. These are two types of interventions where role-play has a very significant and core role, and we will go through in more detail about those in the next slide. But before going there, I would also like to mention that role-playing as a technique can also be used in psychotherapist and counselor training. A big part of training people to become psychotherapists and counselors has to do with, let's say, imitating real-life professional situations, and role-playing can be a very important and helpful educational technique in this context. And it can also be used as such in supervision or intervision. So the process in which a young professional gets supervision by a more experienced professional, a more experienced colleague, or in intervision where peer coaching is being done between colleagues in mental health contexts. Now, let's take a closer look to role-play therapy and fixed role therapy. In role-play therapy, the therapist takes the identity of someone the client is afraid to confront, giving, in this sense, the client space and opportunity to experiment with new behaviors. An example of this can be that, for example, the therapist takes the identity of a parent with whom the client has unresolved issues, and through the role-playing activity, the client can say things they have never said or experiment with new ways of confronting and resolving conflicts with this person. In fixed role therapy, the therapist encourages the client to enact a new role that has been written by the therapist for a time frame that can be up to 2 weeks, in order to try alternative views of the self and the world. For example, a client who suffers from social anxiety can be given a role written by the psychotherapist who is pushing this person to enact the role of somebody who is very confident for 2 weeks. And that can lead this person to embody another version of themselves, an alternate view of themselves, and act in the world very differently. Now, moving to drama-based approaches in therapy. First of all, we need to talk about drama therapy. Drama therapy is an umbrella term for approaches where the intentional use of drama in theater processes helps to achieve therapeutic goals. Psychodrama and sociodrama are more specific applications of drama therapy. Psychodrama can be described as an action method, often used as a psychotherapeutic approach. in which people use spontaneous dramatization, role-playing, and dramatic self-representation to investigate and gain insight into their lives. Similarly, sociodrama uses the same techniques as psychodrama, but in psychodrama, people act out assigned social and societal roles for the purpose of studying and remedying problems in group or collective relationships. Cognitive behavioral drama is an approach that combines cognitive behavioral therapy methods with the art form of drama, whereas expressive arts therapy is based on person-centered therapy, and it's a multimodal approach incorporating various forms of artistic expression. So drama, dance, movement, music, writing, painting, and anything else. Beside these drama-based approaches, we also have some forms of drama that can be used in the context of a psychotherapeutic intervention, but cannot be considered psychotherapeutic approaches themselves. These include theater of the oppressed, developed by Augusto Boal, which is a theatrical workshop form aimed to address needs for interaction, dialogue, critical thinking, and collective action. Playback theater is a type of improvisational theater where members of the audience or the group tell stories from their lives and then watch them enacted on the spot. In improv, most or all of what is performed is unplanned or unscripted, created spontaneously and collaboratively by the performers. Let's now take a closer look to psychodrama and sociodrama. Both of these methods were developed by Jacob Levi-Moreno, and they use a common theoretical framework and a lot of common practitioner techniques. Now, the differences are that whereas psychodrama deals with personal problems and aims at personal catharsis, sociodrama focuses more on social problems and social catharsis. With psychodrama, people can explore interpersonal issues and conflicts, whereas in sociodrama, the participants explore issues or conflicts that arise out of social roles. In psychodrama, somebody is the protagonist, so the owner of the story that is being dramatized, and other people in the group serve as auxiliary egos, or actors that can be used in the whole process of the dramatization. In sociodrama, however, there is no protagonist, and all the group members are equal enactors of the story. Moving on to play-based approaches, we can find many different forms of play therapy. Child-centered play therapy is based on person-centered psychotherapy. So the theoretical framework of person-centered therapy is adjusted to the needs of the play therapy framework. Similarly, cognitive behavioral play therapy is based on CBT therapy, psychoanalytic play therapy on psychoanalysis, Gestalt play therapy on Gestalt psychotherapy, and ecosystemic play therapy on systemic psychotherapy. Now, besides these approaches, there is also the approach of developmental play therapy. This approach provides children with developmental experiences that are essential to physical, social, and emotional growth. Story play therapy uses storytelling and creative approaches for healing, problem solving, and self-growth. Parent-child interaction therapy is a family-oriented therapy designed to help improve the parent-child relationship through interaction and play. And similarly, reflective family play is a whole family treatment through play based on attachment theory and family systems theory. In all of these approaches, role-playing is a very essential element. Looking at some more concrete examples, two intervention or techniques that are used in many forms of play therapies are sand play and puppet play. Sand play makes use of a sandbox, toy figures, and sometimes water to create scenes of miniature worlds that reflect a person's inner thoughts, struggles, and concerns. Puppet play uses puppetry in order to help clients express feelings, reenact anxious events, try out new, more adaptive behaviors, and overcome inhibitions. So these can be seen as two concrete examples of role-playing techniques used in play therapy. Moving on to game-based approaches, we will look more specifically into geek therapy, superhero therapy, therapy board games, the use of video games in therapy, tabletop role-playing, and live-action role-playing. Geek therapy is the effective and meaningful use of popular media in therapeutic, educational, and community practice. It's an affinity-based model of therapeutic intervention and communication based on the theory that the best way to understand each other and ourselves is through the media we care about. This is the definition that one can find at the website of Geek Therapeutics. Superhero therapy, the definition that we can find on their website is combining the practice of clinical psychology with geek popular culture to make mental health a hero's journey, incorporating characters from popular culture into evidence-based therapy to help us learn to become our own version of a superhero in real life. Here, the role-playing is more conceptual and not necessarily used as a standalone technique within the therapeutic session. Let's look at board games and video games in therapy. Therapy board games are games that have been designed to be used as psychotherapeutic tools. Also, many psychotherapists use popular board games and video games in therapy. A form of doing that is using the video game material as a frame of reference to talk about issues within the therapeutic session. Also, there have been some recent attempts at designing video games that function as a counseling tool. Some examples. When it comes to board games, I can mention here the game of Real Life, designed by Jesse Finkelstein. The game of Real Life is based on dialectical behavior therapy, and it aims to cultivate skills that help people remain present and act effectively. Listen, Let's Talk, designed by Laura Jaramillo, helps people communicate more frequently and openly in order to strengthen their relationships using healthy communication skills and bonding activities. What the Fuck Happened, also designed by Jesse Finkelstein, is a chain analysis tool that can be used by therapists, clients, and anyone else who would like to change a problematic behavior. Scenario cards, designed by Roel Vogels, uses what-if scenarios as meaningful mental models, crafted to help people focus on what truly matters, and it can serve as a tool for self-coaching. Lastly, the Boundaries Conversation Deck, designed by Microcosm Publishing, uses what would you do scenarios as prompts for reflection and conversation about boundaries, needs, consent, and relationships. So when it comes to video games, we can mention Sparks. Sparks is a free online video game intended to help young people with mild to moderate depression, stress, or anxiety. It has been designed by a team of professionals at the National Institute for Health Innovation at the University of Auckland in New Zealand. NeuroGrow is another example of a video game designed to treat older adults with depression. It is being developed at the Therapeutic Games and Applications Lab at the University of Utah in the US. And recently, the University of Utah has received a grant from the National Mental Health Institute to perform clinical trials on the effectiveness of NeuroGrow. Moving on to tabletop role-playing and how it can be used in a psychotherapeutic context. So what some psychotherapists do is using existing tabletop RPG systems and adjusting them for the goals of the psychotherapeutic sessions, whereas some others design new systems specifically for psychotherapeutic purposes. In both cases, the scenarios and plots are chosen or designed to address specific issues and situations, and the games are being debriefed as psychotherapeutic material. A great importance is given to safety issues during the game itself and also during debriefing. An example of a tabletop role-playing system designed for such purposes is Critical Core by Game to Grow. Critical Core is a social skills intervention in the form of a tabletop role-playing game. It combines modern developmental therapies with the mechanics of tabletop role-playing games, and it helps game masters align their games to provide specific support to players in the spectrum. Players, through this game, can learn communication and collaboration skills. They can develop frustration tolerance and emotional resilience and build empathy. Critical Core is designed to be accessible to therapists, educators, parents, and gamers, allowing them to use this tool with those in their own community. Lastly, let's see more about the use of live action role-playing in psychotherapeutic context. When using LARP as a psychotherapeutic tool, we mean that the world, the plots, and the scenarios in the LARP have been designed for psychotherapeutic purposes. A special attention has to be given to safety because in the case of LARP, the experience is also embodied. It is essential that there is an off-game area where the players can go to if they feel that the game is being emotionally too much for them and they need a break. And it's also essential to have an emotional safety person available, usually in the off-game area. Also, before the game itself, it's very important to do a careful enrolling, and after the game, a careful de-rolling. Those are terms that come from drama therapy, and they have to do with the process that helps the player get into and out of the character. And also it's very important that we make sure that the psychotherapeutic conditions are present at the debriefing process. Let's look a bit closely to what those psychotherapeutic conditions are. According to Carl Rogers, the psychotherapeutic conditions that are necessary and sufficient for constructive personality change are 6. Those are psychological contact, So the establishment of a psychological contact between, let's say, in the typical psychotherapy case, the therapist and the client. The second one has to do with the state of incongruence that the client is experiencing. And usually this is the reason why the client goes to therapy in the first place. Thirdly, the therapist must be present in the therapeutic relationship with authenticity and congruence. The therapist also must experience unconditional positive regard towards the client and an empathic understanding of what the client is bringing from the client's own frame of reference. Lastly, this empathic understanding and the unconditional positive regard must be communicated to the client. So if we take this into the debriefing, into the context of debriefing a role-playing game, this is the climate that needs to exist in order for this debriefing to be psychotherapeutic for the persons involved. Here we can see two examples of LARP. First of all, a transformative LARP and then a psychotherapeutic LARP to be able to examine also the differences between them. Both of these games that I'm going to mention have been designed by Alexandros Alexiou, who is the CEO of LARPifiers. So Underworld is an abstract LARP that wishes to explore the taboo subject of death as a tranquil experience. Throughout the game, the narrative of ancient Greek mythology is followed by the players, who explore different aspects of death and any bitter lingering taste that may live to them as persons. Ties That Bind is an abstract LARP aimed to venture into interpersonal relationships and people's behavior towards others in their circle through an experimental game-based environment. It features an in-game psychotherapist who has to be played by a real-life psychotherapist. As you can see here, both LARPs have a transformative potential, but in Ties That Bind, the presence of an in-game and real-life psychotherapist puts a more psychotherapeutic dimension into this LARP and makes it more suitable for use in psychotherapeutic contexts and for psychotherapeutic purposes. Lastly, here is some suggested reading that you can look at in order to find more details into the subject, and some online resources that have also been mentioned, some of them during the presentation. If you wish to contact us, here is my personal contact info as well as the contact info of the Transformative Play Initiative at Uppsala University. Thank you very much for watching.